Hello, I'd like to talk about appendicitis. That's our talk for today. Appendicitis, as the name tells us, is inflammation of the appendix. The appendix is a small finger-like pouch. It's attached to the large bowel, very close to where the small and the large bowel meet. And it's the cause of acute abdominal pain, and it requires urgent medical attention. If it's not diagnosed early, it can rupture and it can lead to a serious infection within your abdomen, including formation of an abscess. Now, appendicitis usually starts with a pain in your mid-belly, and then it will radiate to your right lower quadrant. It's going to be worse when you're walking, when you're coughing, and especially when you touch that area, there's going to be severe pain. It's caused by either a hard stool which blocks the appendiceal opening. You can see it with different types of infection, with enlargement of the lymph nodes. Even tumors can lead to appendicitis. So early diagnosis is very important here. If you have these symptoms, especially if they're also associated with nausea and vomiting, or if it's associated with fever, but not always. Not always. In other words, with children or with the elderly, or if you're immune compromised, or with pregnancy, for example, you may not have all these classical symptoms. So if you're having this severe abdominal pain, the best is to present to the emergency room, because with an abdominal ultrasound or with tomography, it's easily diagnosed. The treatment is surgical. With laparoscopic surgery, it's very easily handled. Very rarely it can be managed with only antibiotics, but this is very rare. So if you have persistent pain in your right lower quadrant, especially if it's associated with fever, if it's worse with certain types of activity like with coughing or with movement or when you're touching it, please present to your emergency room. Thank you.